Hey there, it's Dean from sciaticreliefnow.net, and I am with Rachy, who is in Brighton in the UK, about 40 minutes south of London. And Rachy has been dealing with, for the past year, some low back issues, but going back in history about 20 years ago, she fell off a horse the first time, broke her coccyx, and had some sciatica and back issues that went away after a couple years, was it? Do I remember correctly?
2 years, yeah.
Okay, and she was doing pretty well until last April when she fell off a horse again. Has been dealing with some right-sided hip and buttock pain, some right thigh pain, some right calf tingling numbness, and some right foot numbness. So we jumped on a call today. She also happens to be a soft tissue therapist in Brighton. So if I have anybody who's watching this from Brighton, get in touch with Rachy and she'll take care of you, because now she just learned what she can do even to make herself more effective as a therapist. So I will turn it over to her to let her tell you what she experienced today. But first of all, Rachy, thanks for jumping on a call at the last minute after we had to reschedule, and thanks for giving me a video testimonial.
That's okay, no problem. So basically, Dean got me to do some exercises on my non-affected side. And we compared on the affected side and the non-affected side, which side was easiest. We did some repetitions of that exercise, and then we saw how that affected the symptomatic, the affected side. What it actually did was it told the brain that this movement is okay, so let go. And that's what it did. So it let go from a tightness point of view, because I've become really tight through compensations, from guarding, you know, that sort of tension when you're protecting yourself. So afterwards, I have a walk around after each exercise, and so was my dog. I had a walk around after each exercise, and then I felt a reduction of my symptoms, but also just feeling like the joint and the muscles more oiled up. Because I think where you get guarded, you feel really restricted within your tissue, and even if you, whether you have knowledge or not, you know, you have a sense of self, and when things feel like stuck, it can feel quite rippy inside. So when you have that feeling where everything lets go, and you get that nice oil feeling, that nice fluid feeling, and you feel more like water as opposed to dry grass, if that makes sense.
There you go.
Strange analogy, but there we go.
You gain that oily feeling back.
Yeah. So I'm sat now with my affected leg, with my foot over my knee. I've just come straight into this position, and my knee is already a lot lower, just from the exercises that we were doing earlier. So just from sitting here, I have more movement from my hip.
Awesome.
Which is great.
Well, thanks for trusting me all the way across the pond, and thanks for taking me up on this offer.
No, it's an absolute pleasure. Absolute pleasure. I'm going to continue doing this when I go on holiday tomorrow. So